Dr. Zaheer Shah, who's a primary care physician who joins us now from Tempe, Arizona. Dr. Shah, it is great to have you back. The president says that around 20 states, or roughly around 40% of the country, is getting ready to reopen in the near future against this stark warning that we're hearing from the CDC. What is the U.S. doing wrong?
Well, there's a couple of problems. One, the CDC obviously is a federal agency, and one would expect that a federal agency that is the epicenter of guidance in how to manage infectious diseases would be in close coordination with our president. And for the life of me, I don't understand why there is so much chaos with regards to how best to move forward. I think that what we're doing currently is really making a deal with the devil in that we are trying to balance the human life that is being lost as a result of this pandemic against the economic consequences of the only things that we have at our disposal right now, which is social isolation. And I get the dilemma and I get why there would be pressure, particularly in a year in which the president is running for reelection to get the economy moving. But the problem is that we know what the way forward ought to be. There's a two-pronged response here that should have been done by our government, and it has not been done, which is one, we should make testing rampant. We should have more testing done in the United States than has been done anywhere else in the world. We've clearly not met that burden. And then the second thing is that we need to look at new novel technologies like contact tracing apps that can have an amazing effect at using technology to control the spread of this virus. You know, one of the things that's disappointed me is that as I look at pictures of the pandemic of 1918, the Spanish flu, the pictures are eerily similar to what we're doing right now. These people basically had masks and social isolation as their only way to attempt to deal with the Spanish flu. Well, guess what? 102 years later, that's all we've been able to come up with are masks and basically social isolation. There are no medications that are therapeutic, effective against this medication, and there is no vaccine up until now. So I'm very fearful that what the CDC is telling us is that there could be a perfect storm come this fall. Keep in mind, when this pandemic began in the United States, the flu season had already been tapering down. And as a result of that, there wasn't a nexus between these two very potentially infectious problems that the American public would face. But now, as we're reopening state after state, we're going to again potentially develop a critical momentum that could result in that perfect storm happening, which is that this fall we could have both the flu as well as a recurrence, a revival of the coronavirus that could be really epically devastating.
And what would a second outbreak look like, Dr. Shah? And how would that impact you at your practice when you're already bogged down dealing with coronavirus patients?
Well, there's so much that's unknown about this virus that it's difficult to make predictions. If you remember, the initial models that were used by the CDC and by the Vice President's Corona Task Force estimated that deaths would be somewhere between 100,000 and 240,000. And then, as the curve began to flatten, particularly in New York, I think the administration concluded that it was time to lower the estimates. And so, as you may remember, they lowered the predicted mortality rate in the United States to be around 60,000. Well, we're already over 40,000, which means that we're going to get to 60,000, as sad as that is to state, and that we will probably exceed it, which tells me that we just don't know enough about this virus to know what the level of carnage could be. But here's what's going to be different about the fall is if we continue to go on the course that we're on, which is we're going to reopen our economies, which basically means that we're going to ask people to resume their daily routines. That means go to pubs, go to restaurants, go to sporting events, and go to other venues where there's going to be a lot of social contact. And what may happen here, and this is what I'm fearful of, is that as we allow this virus to freely pass from individual to individual by virtue of going back to a normalization of economic commerce, that the next cycle may actually be worse. And if that happens, then I think we're going to really test our healthcare infrastructure, and I'm very worried about that.
An interesting fact to come out of this is a Reuters poll revealed that more than 70% of Americans want to continue to shelter in place despite the economic impact, including more than half of Republicans. So, despite what we're hearing at the federal level and the pockets of protest that we're seeing at the state level, it does seem that people kind of get it. I mean, you look at the people that have been coming out of lockdown in Wuhan, and there's still a great amount of social distancing. Do you think that the message has sunk in enough for Americans that despite the calls to get the economy back up and revving again, people are going to be more vigilant because they don't want to catch this virus? They don't want a lot of the symptoms. They don't want to be on a respirator. And especially if you're somebody that has preconditions of any sort, you're really going to be worried about it when things start to reopen up again.
I think you're absolutely right about that. And I think that what is happening here is that you're having this titanic collision between the health concerns of the public and the economic concerns of corporations and other entities that have a vested interest in getting the economy running again. And it is a very dangerous deal with the devil that we're making here. And I believe that the average American, as your poll illustrated, and I have also read the results of that Reuters poll, is that the vast majority of Americans get it. They get what the implications are. Look, the when I was in medical school, I vividly remember the professor that was teaching me microbiology telling me that, look, pandemics are not a question of if, they're a question of when. So they're an inevitable part of the biology of this planet. They happen. Fortunately for us, nothing this devastating hasn't happened in over 100 years. But now that it's upon us, we're going to have to make some really iconic, epic decision making. And my fear is that what's happening here is that there are interests that are going on that are intending to incite an artificial sort of revolution against what is just scientific sense. We have to go back to what our best minds and our best scientists think and really listen carefully to their recommendations. There are no conspiracies here. This is not a political issue. COVID-19, this pandemic, is a public health crisis like none that we've seen before, and we really need to let our best scientific minds guide us through this darkness. And my fear is that instead, we're letting our economic interests and those parties, those stakeholders in our economy start to dictate public health, and it shouldn't be that way. And I think in part, that's why the CDC's director today issued these comments, is to say, look, I guess I see the rush towards opening up states, but the real fear here is that there could be a consequence of this, and we may be having to pay the ferryman come this fall.
Dr. Zaheer Shah, it is great to have you back. We really appreciate you being with us to add your expertise.